Hello, I'm Ping Wang from the first affiliated hospital of Nanjing Medical University, under the mentorship of Professor Liuqin Jiang. It's a pleasure to share our team's study published in gastrointestinal endoscopy, clinical characteristic analysis of anorectal function changes after endoscopic submucosal dissection for rectal lesions. ESD has become a cornerstone for treating rectal lesions, from benign adenomas to early-stage cancers, thanks to its minimal invasiveness and ability to preserve digestive tract structure. But as we adopted this technique more widely, we noticed a gap. While we knew ESD was safe and effective, there was little systematical data on how it affected anorectal function long term. Patients would sometimes report symptoms like increased bowel movements or urgency, but we lacked the clarity on their incidence, duration, or what factors influenced them. That's why I launched this study to fill that knowledge gap and improve patient care. We analyzed 296 patients who underwent rectal ESD over 4 years, tracking their symptoms and quality of life using validated scales like LAS, Wexner, SAS, and Giggling. What stood out? About 27.7% of patients developed anorexia symptoms post-operatively. Most commonly increased bowel movement, anal discontent, urgency, and loose stools. Importantly, these symptoms went random. Lesion location and size were key predictors. Lesion close to the anus within 5 centimeters or larger than 4 centimeters raised the risk significantly. Encouragingly, symptoms improved over time, with most resolved by 3 to 6 months, alongside better psychological well-being or quality of life. Our study links lesion traits to function outcomes, aiding preoperatively counseling and highlight monitoring both physical and psychological health. Next step included prospective study with objective measure to understand symptoms cause and exploring targeted intervention for high-risk patients. In short, considering lesion characteristic in preoperative assessment helps optimize care for ESD patients. Thank you very much for the opportunity to share our research. I would also like to extend my gratitude to my co-authors and the team at gastrointestinal endoscopy for their support throughout this process.